Hello and welcome to the EduTalk series hosted by Biotone Edu Partner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Elisabeth Clark, who has over 25 years of direct marketing experience in both the manufacturing and distributor sides of many diverse markets. For the last 19 years, Elisabeth has directed the sales and marketing efforts for the Therabath brand of therapy solutions, serving the massage, spa, and wellness industries. Many of you may have seen her at some of the industry trade shows. Let's listen and learn as Elisabeth shares a simple, cost-effective thermotherapy modality for providing comfort and therapeutic relief to clients with arthritis. She'll include how adding the complex benefits of moisturizing heat therapy relieves arthritis pain, joint inflammation, muscle stiffness, and boosts circulation, allowing clients to feel renewed and continue their active lifestyles. We have a lot to cover. Please be sure you have your sound and video off. And with that, welcome, Elisabeth. I'll turn it over to you and see you on the other side.
Sounds great, Donnell.
And everyone, feel free to chat questions, which Elisabeth can answer at the end. Thank you.
Thank you. Thank you so much, Donnell, for that great introduction. Great friend of mine for many years. And I've probably seen many of the people on this EduTalk today out in the industry. I definitely have been to many of the conferences out there. So if I've seen you before, it's great to see you again. Otherwise, welcome. Again, thank you to Biotone. Donnell had mentioned for putting on these EduTalks. We're really excited to be a part of it. Therabath has been around specifically for over 60 years, and I've been with the company just about 20 here. I'm just about to have my anniversary. So I know the topic well. I'm excited to talk about it and share. We'll leave some time at the end for questions. So please feel free to put those in the chat, and Donnell will be going through those at the end. So I'm going to go ahead and get started on the presentation here. Hopefully everybody can see this well. We did test it out. So as Donnell mentioned, we're going to talk about moist heat and how it can benefit your clients with arthritis. Just a quick overview.
Elizabeth, sorry to interrupt.
Yes.
Do you have the PowerPoint presentation up through share screen?
Yes, I do.
Showing.
It's not showing. Okay, I will go ahead and do it again here. I apologize for that. Are you able to see that?
Yes.
Okay, and just the screen itself, not notes and things, correct?
We see the overview page.
Okay, perfect. Okay,
thank you.
I will continue on. I have two monitors, and so I want to make sure I'm showing you the right one. Okay, thank you for that, Donnell. Okay, so the overview then. So I'm going to talk about what is thermotherapy, even more specific, what is moist heat therapy, and then even more specifically, what is paraffin therapy. I'll also talk a little bit about moist heat packs and how they fit in, how moist heat therapy can help arthritis sufferers, who else can benefit from moist heat therapy, and how you can incorporate this into your business. And then, as we mentioned, we'll have some time for questions. So let's start off just with the most basic level here. What is thermotherapy? So thermotherapy involves applying heat or cold to joints to improve the symptoms of arthritis. Heat may work by improving circulation and relaxing muscles. So at the very basic level, this is what thermotherapy includes. So there's a lot that falls under here. We are specifically going to concentrate, however, on heat therapy, and even more specifically, moist heat therapy. So moist heat therapy is a form of thermotherapy, and it uses a wet source to transfer heat to the tissues in order to achieve pain relief. It has been clinically proven to penetrate quicker, and we're penetrating quicker than dry heat in this case, and deeper than dry heat, and has a powerful response from the body's temperature receptors. So some examples here of other moist heat therapies in addition to paraffin: hot water bottles, steam towels, saunas and whirlpools, and then the paraffin bath and moist heating pack that we're going to talk about specifically. So the next step here then is, what is paraffin therapy? And paraffin is very simply a specific form of moist heat therapy. So there isn't much required to be able to actually do a paraffin treatment. The picture here shows a paraffin warmer. It's also called a paraffin bath. And the warmer is essential to safely melt the paraffin and to maintain a proper temperature. A lot of times I'll hear of individuals using a double boiler on their stove, for example. It's a very dangerous method, something that people have done for probably 100 years, of course, but when we're involving other people, clients, that type of thing, we want to be sure that we're not going to burn anybody. You also need paraffin wax that's formulated for therapy. So it's really important to know that not all waxes are created equal. So a therapy wax has a specific melt point. In this case, or with the Therabath brand specifically, it's about 120 degrees Fahrenheit to 121 degrees Fahrenheit. There are definitely other waxes out there, things like canning wax that you'll find at your grocery store, much too high of a melt point, and really the paraffin warmer won't be able to actually even melt that paraffin. It could be somewhere around 100 to 170 degrees, 150, excuse me, to 170 degrees melt point. So the warmer would just never even be able to melt something like that. Other waxes out there would be beeswax. That's a question I get a lot, is whether you can use beeswax for paraffin therapy. And it just does not perform the same as paraffin itself. So paraffin's a very specific type of wax. It doesn't stick to the skin, doesn't remove hair, things like that, and it forms a glove in a specific way. So the moral of the story here is not all waxes are created equal. A therapy wax is needed specifically to do paraffin treatments. You need a secure space where you can put this bath so that it's not going to get knocked into. It can be plugged in all the time. And then just really a quick training session on how to actually do a proper paraffin treatment. So it's important to know what areas can be treated with paraffin. And I've got some photos here. The most obvious areas are those that can be dipped in the bath itself. So this Therabath here holds up to a size 14 men's foot. We do have somebody in our office with that size of foot, so we've actually tested it to be sure. But really the most effective areas to treat are hands and wrist, foot and ankle, and really just that outer elbow. The photo on the far left there shows what we call paraffin strips. These are wrapped around an elbow in this case, but they allow you to use the paraffin on the entire body. So this allows you to do a heat therapy on the whole body, including the shoulders, the lower back. You could do paraffin facials. The elbow and the knee are really probably the most used areas for paraffin strips. They're very inexpensive. I think $2 or $3 for a pack of 40 strips. Now, when we dip in the paraffin bath, though, what makes it the most effective method is that you get a complete coverage around the joint. So you're getting that wax around the entire joint, penetrating the heat and trapping in the moisture and the heat. There's other methods, excuse me, of doing paraffin treatments. For example, putting the paraffin inside of a plastic bag first and then immersing the hand or foot in the plastic bag. Though this can effectively bring heat to the area, it's not as likely to relieve arthritis joint pain. And the main reason for that is just the loss of heat in the transfer into the bag. You're not going to also be able to build layers of paraffin. So we dip in the paraffin and we do it multiple times. So I apologize, I'm not demoing today, but the idea is you dip your you dip your hand, let's say, into the paraffin, you come right back out, you let that paraffin set, and then you continue to do this, adding additional layers of paraffin. So the more layers of paraffin that are on the hand or the foot, let's say, the longer the heat will last and the more effective the therapy will be. I do always want to be sure to note that it doesn't make the paraffin hotter. Also, leaving the hand in the paraffin doesn't build the layers up thicker. These are things that people have asked over the years, and so I'd like to be able to mention those. So how does the paraffin actually work? So I did mention when you dip your hand or foot or other area, like the elbow, into the paraffin, your body is rushing blood to that area and it's instantly cooling. It's then forming, we call it a glove, but it's really a protective layer on the skin. So this happens because your body temperature is, let's say, 98. The paraffin's about 130 degrees Fahrenheit. So the very instant that a hand or foot is immersed into that paraffin, your body is going to rush blood to the area, instantaneously cool that paraffin and form a protective barrier. You would never immerse your hand in 130-degree water, for example. Water does not build a protective layer, and therefore you're immersed in that heat for the entire time. In this case, you get the protective layer, and then as you continue to build layers, you're really just, I like to say it's like a big candle. The larger the candle is, the more hours it'll burn. It's very similar. The more layers of paraffin you build, the longer the heat will last. As a moist heat therapy, the heat will penetrate more quickly, and with the higher temperature, the therapy can get deeper into the tissue to relieve pain and promote healing. And it promotes healing by increasing blood flow. I mean, ultimately, that's what heat therapy does. It increases circulation. And so that's all we're really doing here. It's a very simple modality in that we're applying heat to increase the circulation, but it can be very beneficial for pain relief and to help promote tissue growth or tissue regrowth. Also, the residual oil that's contained in the paraffin, along with the trapped moisture, so you're going to sweat underneath that glove of paraffin, that's going to be trapped under that glove. And so it has nowhere to go but basically back into those open pores. And so paraffin became really popular in the spa, massage, nail industries, really for the side effect of the heat benefit that you get. So it was originally designed for arthritis joint pain relief. It's an FDA approved modality for pain relief for arthritis, and we are able to make that claim. But it's also very effective in moisturizing the skin, even without any product. For example, a biotone lotion, for example, which would be a great addition to a paraffin treatment. Even without that, there's still going to be some additional moisturization that happens just because of the properties of the paraffin. So I wanted to be sure to point out some arthritis facts. I don't claim to be an expert on arthritis itself, but at the very basic level, these are things that I know to be true, and that we have some cited references, of course, that I've included in the slides if you'd like to look at them later. But arthritis in general is a disease that affects the musculoskeletal system, specifically joints, tendons, ligaments, bones, and muscles. And it's also really important to know there's no cure for arthritis. So even these heat treatments, they aren't going to cure arthritis, but they can help with the pain and inflammation that people are feeling as a result of the arthritis. Unfortunately, in the US, 21% of all adults, or 53 million people, have arthritis, and it's the leading cause of a work disability. So we see oftentimes paraffin baths are in work facilities and break rooms, and they're a great thing to just have available for employees, so that if they're feeling pain or discomfort during their work shift, that they have a way to get some relief and hopefully not have to go home due to pain, and they can get back on the job more quickly. And then the most common form is osteoarthritis. There are over 100 forms of arthritis, actually. With paraffin therapy and heat therapy, we tend to concentrate on the osteoarthritis and rheumatoid arthritis. Certainly, there's also things like lupus, gout, that are forms that people are very familiar with. And of course, the whole juvenile arthritis effort to help children and kids and pediatrics with arthritis. So this graphic here is just depicting what a healthy joint would normally look like. The osteoarthritis, you're seeing that loss of the cartilage elasticity, so it's really bone on bone there. And with the rheumatoid, you're seeing the inflammation of that synovial membrane. So we talk about synovial fluid a lot with paraffin therapy, and so I'll talk about that in just a moment. But really, the heat therapy is is helping with the symptoms of both types of arthritis, and that's pain, aching, stiffness, and swelling in and around the joints. And one thing I also like to talk about is it's important that people are missing work, but it's also important that people aren't able to do the things they most enjoy in life. So we've used a tagline for many, many years that life is most enjoyed hands-on. And if you think about that tomorrow or the next few days, you'll realize how many things we do that involve us being able to pick things up or, open and close our hands without pain, and how eliminating it can really be when you're in pain. Of course, that holds true with other joints, your knees, back, feet and ankles as well. But our hands specifically are things that you can think about throughout the next few days and realize, gosh, if my hands hurt, this would be really tough for me to do. So how is the paraffin actually helping? So paraffin therapy in general is a non-invasive, non-drug, non-surgical pain relief treatment for the symptoms associated with arthritis. These are all things that are really important for a therapy. If you think about, for example, drug, and that could be even just ibuprofen, that's a systemic drug that goes throughout your whole body. If you have pain in just your hands, then there's a lot of people that would say, you know what, I don't want to take drugs that go throughout my whole body when I just have pain in this one isolated area. It's also non-invasive and non-surgical, which could be the same. I suppose you could group those together. But there's a lot of pain and recuperation and rehabilitation that goes with having invasive surgical treatments for arthritis. And so if we can get people moving and exercising and allowing the range of motion and the lack of pain, let's say in their hands or their feet, we can help push off those types of invasive medical situations longer than if we did not treat if we did not treat the symptoms. So in general, paraffin therapy is providing instant warmth and relaxation. Relaxation alone is a very important part of care, and our mind, just easing our mind as well as relaxation in the muscles are both very healing things. Paraffin provides a therapeutic relief of pain due to arthritis, joint inflammation, muscle and stiffness, and injury. I've said that many times here already this afternoon. And really what we're doing is we're increasing the circulation and promoting renewed tissue. Paraffin specifically has a very high thermal conductivity. And so that provides, again, that 130-degree temperature. Again, a jacuzzi tub may be 105, 107, depending on the person, I suppose. But those temperatures are nowhere near what a paraffin treatment is at 130. So that allows that heat to get deeper into the tissue than other therapies that might be out there. And also another really important piece there is that high temperature can actually liquefy that thickened synovial fluid. So on the graphic, I'll go back one step here. You can see specifically on that rheumatoid arthritis graphic, that red area there, that's the inflammation of that synovial membrane. When that becomes thickened, it's very difficult for a person to have flexibility and range of motion. And so the temperature of the paraffin can help liquefy that thickened synovial fluid and allow the blood to get through. That really reduces pain. It allows for flexibility, and it reduces the inflammation. And again, that's just the heat doing that. There's no other additives or things in the paraffin that allow that to happen. It's truly just the heat and the temperature of the heat. So in all my years here with Therabath, I find that sometimes purchasing a paraffin bath, though there's many price ranges out there, it just can be too expensive. It can be, it can take up a lot of time, be intrusive in a home if somebody's got a smaller home that they're living in, or a clinic or office even. And so heat packs are also a very effective heat therapy. So here I'm showing some. These are like a professional line, I suppose, with the fabric and everything. There's definitely others out there. Therabath has these specific brands. We market them under Solage Therapy if you were to Google them or what have you. But at any rate, the heat packs themselves can be warmed in a towel warmer or a microwave. Now, most people, if they're going to use this at home, they're not going to have a towel warmer. That's really more in an office setting where you'd have that equipment, but easily heated in the microwave. It's really important to do some research on the ingredients that are in the heat pack. These ones I'm showing here have rice and a little bit of orange peel in them. Be very careful with flaxseed or I'm trying to think of the other some that have husks and things like that in them. They can easily burn in a microwave, so you want to be really careful you don't throw this in for like 5 minutes and hope all's good. You're likely to get some burns in that case, and so you just got to be really careful of that. So just want to caution everybody on using the microwave in that case. Now, a hot towel warmer, oftentimes these can sit in there for days. I know in our office we have a hot towel warmer. It's cold here in the winter in Minnesota, and so we just leave them in there. And if we have an employee that's cold, they can go grab a heat pack, put it on their lap. So that's what these pictures are showing. The first top left is a heat pack on the lap, and in that case, it would really be used just for relaxation in general. Heat packs are like a warm hug, we like to say too. So just like a weighted blanket might be. It's going to be very calming and relaxing. The one on the top right there is a full back. That's one that can also be laid on as well. It can go down a whole leg. So these are pretty versatile, just showing some different uses. One on the knee there, and then of course the neck wrap style that goes around the neck and the shoulders. So the great thing about heat packs is that when they're cool, or let's say they stay warm for about 20 minutes, as they come down in temperature, they're at least going to stay ambient temperature. Hot towels, they'll use a lot. They can become kind of cold and wet, and they're pretty uncomfortable for the client. I know myself, I've had treatments done, and there comes a point where the hot towel comes out and you really look forward to it. Sometimes it can start out way too hot, which is uncomfortable. And then as it cools, it can be kind of cold and wet. So what's nice about hot packs is that they're not going to do that. They're at least going to be ambient temperature. I already mentioned that weight being really relaxing. Again, a great alternative to paraffin if space or budget doesn't allow. And then if these are going to be used on multiple people, there are covers and things that you can use. You can put them on the outside of a sheet as well, so that there's a washable protective barrier between the heat pack and the client. So heat therapy is not just for arthritis pain. So I think we all probably could have guessed that, but I really like to talk about, anybody can benefit from moist heat therapy. I can think of anybody in my life right now that either has a hobby, a job, a sport, or something that they're doing, maybe arthritis, that they would benefit from using moist heat therapy. So I list some of these here. Some of the pictures kind of show too, like the top picture there of somebody working in or sorting fruit, and it could be a cold environment. It could just be the acid from the fruit on the hands drying out the skin as well. So that could be kind of twofold. Playing the piano or any kind of repetitive sport or hobby, you tend to get some pain, inflammation, and joint stiffness from those things, and you can benefit from the moist heat therapy there. And then also just getting out and moving. So ankle could be a sprained ankle if you step wrong, then paraffin can be used, or moist heat therapies can be used in the rehabilitation sense as well. So just to go through the list here, anyone looking for relaxation and comfort clearly can benefit from moist heat therapy. It's like getting in a warm bath or a hot tub. That's something you can easily do in the comfort of your living room. So sports enthusiasts, we talked about, with sore muscles or joints, hobbyists, workers that specifically repetitive motion with jobs can be very damaging to joints and hands. People can have a lot of pain from that and then miss work. We talked about the outdoor and cold environments, dry skin sufferers, and really self-care is something we spend a lot of time in this industry about. In the massage industry, the spa industry, is first and foremost, our care providers need to be taking care of themselves. This helps ensure a long, healthy career enjoyment of the career for certain. And when you're giving self-care to others, don't forget to take some time out to give self-care to yourself as well. And so how can you incorporate thermal therapy into your business now? Offering as an a la carte treatment, there are definitely people who have, let's say they've been to a physical therapist for an injury and they've had paraffin and they see it on your menu and they'd like to experience it again. So a lot of times people are introduced to paraffin therapy either at the spa when they get their nails done or at a physical therapist. So those are the two places that they're going to have also the least probably educated therapy. So they're not going to necessarily be talked through it too much. They just know that it feels great and they feel great after having it. So it's great to have it just as an a la carte on your list of services available. Adding it on to another treatment is really what I hear the most, in that, let's say somebody's coming in for a facial or a massage or something like that. Why not add on paraffin in the treatment, use as a treatment in the waiting area while clients wait for their appointment? This is a great thing, especially if you're running behind on services. Give people a paraffin treatment. The cost for a professional to give a paraffin treatment is about $1 to $1.10. It's very, very cost effective and it makes a huge impact. It also helps you gain referrals. So if you're having these add-on services that people just love and they feel really good about, they're going to tell other people about it. They're less likely to they're less likely to cancel an appointment because they're looking forward to going to the appointment. We talk about this a lot in the physical therapy market, in that sometimes it can be really painful to go and get a treatment. You're in pain, you had an injury or surgery, and now you're being asked to do things that don't feel that great. And so paraffin is actually a most asked for treatment, especially in hand therapy. But patients really look forward to that, and clients do as well. So let's say that you throw it on in the month of December. It's cold outside and your clients have been out hustling and bustling in the cold. Let's do paraffin treatment and hope that people actually follow through and come to their appointments. They're not too busy. They can get a paraffin on the side. Word of mouth advertising also in this case. So it kind of goes along with gaining referrals here, but it does get people talking about your other services that you're offering. So it's just a really good add-on. So I spoke pretty fast here. That's all I have as far as slides that are prepared. I'm ready to answer any questions if there are any. I know I kind of spoke kind of fast here, but let me know, Donnell, I see you again. Are there any
I'm here, I'm back.
questions?
Well, I have some questions.
Okay.
And at first you mentioned facials.
Yeah.
Which would they be using the strips?
Yes.
The strip, that's how you would use it. You wouldn't brush like the wax, the paraffin on.
You could. I'm going to go back to that slide just to show that strip again on the arm. So as we already said, I've been here 20 years. So when I first came to the company 20 years ago, we had gauze masks. And so that was also a really common way to put paraffin on the face. So paraffin's really great to open the pores. It reduces fine lines and wrinkles because it's going to plump that skin with that heat. So I phased out those gauze masks because I didn't feel that it was giving the right adhesion. I'm sorry, I'm looking at the wrong camera here, but over the bridge of the nose and the chin, that the gauze masks would lift. And so the paraffin strips are a really nice alternative because you can layer them on the forehead, the chin, you can tear them apart and get them to be the right size that you need. And so the strips are really the best way to do a facial. The brush is also a very common way to do a facial. Now, I caution trying to do a paraffin facial on your own. It's something that is best done with a partner, somebody who can help you so you're not getting paraffin in your eyes and that type of thing. Therabath does offer it's a pretty heavy ceramic bowl with a brush and a ladle, and it allows you to get up right close to the face with the brush. So you're going to help retain the heat of the paraffin in the bowl, and your brush isn't going to get all gunked up with cold paraffin. Because of course, as soon as you take the brush out of the paraffin, it starts to cool. And if you don't use it right away, it gets pretty clumped up with wax. So it allows you to get really close and then just get right into the face. So brushing is also a technique. And I actually even recommend doing strips and brushing.
Okay, and multiple layers as well.
Correct. Multiple layers as well.
All right. And you did mention, well, just thinking about the paraffin in the waiting room, it's paraffin first, then you would have your massage or your treatment. Is that how it would work? Okay.
Correct. It's tough. It's really tough to incorporate paraffin during a massage on a client. Because somebody is unclothed in most cases and laying on a table, it is possible to bring a paraffin bath over to the table on a cart and dip a hand in there. It can be a little bit cumbersome. I know that a lot of therapists have found putting paraffin in the plastic bag. I had kind of mentioned that method earlier, and then putting the hand in it while a patient is on the table is a method to apply the paraffin. And it definitely is. You have to be a little bit careful so that your client doesn't, lift their hand like this and all the paraffin comes out the bag and down their arm. So that is something to be careful of if you do the bag method. So in the massage industry, for us, we really focus on self-care more than paraffin on the client during a massage.
Okay, thank you. Trisha raised her hand. Oh, but I didn't know if she had a question.
I would just be curious. Hello. I would be curious. You can't really use the paraffin on knees, right? Because there's no way to dip a knee.
Correct. So the knee would also be a good candidate for those paraffin strips.
Okay.
Yeah. And so we sell quite a bit of them into the PT market, and they use them mostly for knees. I would say I also find a lot of therapists using them on the ankle and the foot. So
you showed a picture of those two? Sorry to interrupt you. Could you go back to show a picture of the wraps and the strip?
Yeah, can you see the, whoops.
Okay.
It's on the elbow here.
Oh, okay. Okay.
The bottom there. I didn't put them in here, but I do have pictures of it wrapped on the knee, but it's the same process. So you basically take the strip and you would dip it in the paraffin and let the paraffin drip off, and then layer them around the area. And just as you would dip and do layers, you would layer with those paraffin strips too.
Okay. Thank you.
Yeah, you're welcome.
Elizabeth Aline is asking, is there a way to reuse, recycle, clean the used wax? I love the results of using this, just don't like adding to the landfills. So how do you keep it clean and reusable?
Right. Those are two really great questions. So as far as keeping the paraffin clean, now it depends on if you're using this in a community setting or if you're using it at home. So we kind of have two different opinions on cleaning the bath and how often you need to clean it. So if you're at home, I'll start with that. A person who has a paraffin bath in their home, in most cases, will take the used paraffin off and put it back in the paraffin bath, and we'll remelt that paraffin. So it allows you to use the same paraffin for a really long time. So what I left out of this presentation, and I'm happy to share links to, I can provide those to Donnell, is that the paraffin itself, because of the physical properties of the paraffin, it cannot be contaminated. There's no water, there's no oxygen, and the paraffin's 130 degrees. So any kind of pathogen, bloodborne pathogen, mold, fungus, bacteria, virus, COVID, it came up a lot during the pandemic. We had a lot of questions about whether the bath can be contaminated. None of those organisms can survive without water and oxygen. So as far as reusing the paraffin, if you're at home and you throw it back in there, the thing that's going to happen is you're going to get a lot of, we call it crud, or I call it crud in the bottom. You're right. You're going to get dust or dry skin or whatever comes out of that paraffin. It's going to go all to the bottom because of the density of the paraffin. Anything that gets in there is going to go to the bottom of the bath. So you're going to start to see sediment in there more often, more frequently, and you'd have to clean the bath more frequently. So there's a couple methods to clean the bath. So I'll add that piece in next. The easiest way is you unplug the paraffin bath, you let the wax get completely hard, which is overnight. The next day you plug it in for maybe 10 minutes. Now we have a spatula, a little plastic spatula that you can put in kind of, around the cake of wax to loosen it up. And you just dump the bath over and the whole chunk of paraffin will fall out. So in that instance, you want to make sure you're not running that bath with no wax in it. So be sure to unplug it. And you just need to wipe out the bottom of the bath with a soft towel. There's nothing to disinfect here. If you feel more comfortable using a very mild cleanser, that would be fine, but there's really nothing in here because like I mentioned, there's nothing can survive, grow, or cross-contaminate because of the properties of the paraffin. And that after you've done that, you can put your chunk of paraffin back in there and melt it again, and it'll be clean. Now, in a community setting, we have a pretty different school of thought. And I know for myself, if I went into, let's just say spa in general, if I went into a spa and I saw that they were reusing the pedicure tub or something, I wouldn't want to go in there. I don't want to be educated on why it might be clean. I'm not going to want to go in there. And it's the same with the paraffin bath. Unless a shop owner or a therapist or a person giving the service wants to educate every single person on why that paraffin bath is clean, we don't suggest reusing paraffin for sure. And we also suggest following best practices and make sure that the person that goes in there is clean. Now, clean could mean soap and water wash. It could mean a cleansing spray or cleansing gel. But be sure that the person that's going into that paraffin bath is clean and that you're removing the paraffin and discarding of it. So the next question was about filling the landfill. So I should give a little bit more history on what paraffin is and where it comes from. So paraffin actually comes from the same place in the ground that we get like Vaseline, mineral oil. So it's a very, very small percentage of petroleum product. A lot of times we can have people not want to use paraffin because it's a petroleum product, which does in fact mean it is a natural product. It does come from the ground, but it's a very refined product. When it goes back into the ground, it goes back to where it came from, right? So as a wax, it's going to melt and it's going to go back into the ground. There's nothing harmful in the paraffin. If there was, you wouldn't be able to use it on your skin. We put a little bit of food grade color, a little bit of food grade dye, or unscented has absolutely nothing in it but paraffin and white oil. So though it's a great question, and we do understand that people like to recycle or not throw things in the landfill, the paraffin itself is going to dissolve or melt and go basically back to where it came from. Now, for plastic liner bags and things like that, those are things that definitely would go into a landfill. At this time, Therabath doesn't have a compostable liner bag, but that would be something I would encourage users to look for. I know that they're out there that can be pretty expensive, but there are compostable bags and products out there that would then, not fill a landfill. So hopefully that answered all parts of the question.
That's great. I saw in the bottom of one of your slides about contraindication, diabetic neuropathy.
Yes.
Could you explain a little more of that, please?
Yes. So with diabetic neuropathy specifically, people who have diabetic neuropathy, let's say in their feet, which is where it will start, it's the farthest place from the heart, and that's where neuropathy will begin. If somebody has neuropathy in their feet, it doesn't mean that they can't dip their hand in the paraffin, but the reason it's contraindicated is because the body can't feel the heat when they have neuropathy, and so the body is not going to rush blood to the area to cool it and form that protective layer, and so it can be very dangerous. Somebody can get burned. Now, I will say the Therabath specifically, because that's what I'm talking about, doesn't get to a hot enough temperature to actually burn a client or a patient. There are safety features in the bath with both thermostats and fuses and all kinds of things, so it's never going to run away and get too hot. It's not at a temperature where it will scorch or burn somebody. But that being said, it's very dangerous for somebody with neuropathy to immerse in that heat. So now there are other people out there with neuropathy that find it can be very helpful for them because it's helping them with sensation and it's getting blood to the area. And but we really say under the care of a physician who's saying, yes, you're not at a point in your neuropathy where you could be seriously injured. And that's the same with circulatory disorders. So your body's not going to detect that heat and be able to rush blood to the area quickly enough to give you a protective layer. Some
Very
other
interesting.
contraindications I should mention are things like open wounds. If somebody's had a surgery or has an injury that has very fresh skin, the temperature is very hot and can damage that new skin, and it's very uncomfortable as well. So that would be another contraindication.
Well, thank you, Elisabeth. Now, there's still a minute or two to ask any last questions.
Yeah.
And what's on your last slide, Elisabeth?
Oh, yes. I have some contact info here as well. So I talked about both the Therabath is the paraffin bath, and then Solage therapy is where you can find those heat packs that were presented in the slides. For EduTalk 23, if you use that code on either of those sites through the end of the month, you can get 20% off, which is great. And there's some shipping promotions going on too to even further help that savings. And then following us on Facebook or Instagram are also great ways to see what different kinds of promotions and things we're doing. And we're trying to focus some more on just like product focus in general too. So be on the lookout for those things.
Well, great. I will include this code and the discount information in the follow-up email that everyone will receive tomorrow with a copy of the recording link.
Okay.
And if they had specific questions for you,
yes,
how would they go about contacting you? What's the best way?
Yes, I can also add an email address into this slide before I send the presentation to you, Donnell, but I can be reached at it's E as in Elizabeth, so it's EEC at wrmed.com. So EEC, which is my initials. So EEC at wrmed.com. And I can put it in the chat too if that's helpful.
Yeah, that's helpful.
Okay, yeah, I'd be happy to do that.
Yes, and I include not only the recording link, the discount code, but Elisabeth's contact information as well.
Yes,
and
happy to answer any other questions. This is what we do every day, so I'm happy to discuss further.
Well, thank you so much. And if there are no other questions or comments, I'd like to take a moment and invite you all to join us in 2024 for not only our massage EduTalks, but the recently launched EduTalk Diabetes series. And we start the year, we're taking a break over the holidays for EduTalks. We will pick that up again and launch into an exciting year ahead, January 16th, with the EduTalk Diabetes series with Dorothea Atkins. And she will be presenting a new self-management approach to diabetes, self-massage. That is followed by January 23rd. We have Eric Brown presenting on 60 clients in 60 days. And Eric has previously presented an EduTalk on feigning after and during chair massage, which is in the archive library under the EduTalk tab on biotone.com. And we end January 30th, with Dr. Tiffany Ryan, who has also presented in EduTalk this past year, trauma-informed body work, knowledge needed to do no harm. So that's our January lineup. Watch your inbox for invitations to RSVP to the diabetes series and the massage series. Meanwhile, have safe, wonderful, healthy, happy holidays. And we'll look forward to seeing you in 2024. Elisabeth, thank you. And one thing in closing,
Yes.
the massage trade shows, do you know the ones you'll be doing in 2024?
Yes, we'll definitely be at AMTA. So that's one that we go to every year. We also do go to the aesthetic shows. So if anybody tends to go to those, we'll be at the New York and Las Vegas shows. So far those three are certainly already on our agenda. Looking forward
Well,
to it.
wonderful.
Yes.
Thank you so much.
Thank you again, Donnell, and
And
thank you, Biotone. I'm really excited to be a part of all of this. And thank you everybody who joined.
thank you everyone who joined, and much success in the year ahead. Thank you,
Yeah.
everyone.
Yeah. Thank
Take
you.
care.
Bye-bye.
Be
Bye-bye.
safe.
Bye. Bye.
Bye-bye.